This is Brent of the Brookbush Institute, and in this video we're going over manual therapy techniques, specifically instrument-assisted soft tissue mobilization. Now, if you're watching this video, I'm assuming that you are a licensed medical professional with instrument-assisted soft tissue mobilization within your scope of practice. Now, there's some gray area here. Not every state has legislation around these tools. If you're not sure, check. I would hate to see somebody getting in trouble because they watched one of our videos and used it on a patient or client when things did not fall within their scope of practice act. Now, these tools, just like all of our other techniques, fall within a model of practice, and we are very big on assess, address, reassess. So even though these tools are specific to perhaps fascial tissue, we're still going to base their use on reliable assessments. We're going to use these techniques, and then we're going to reassess, and if they're not effective, we're not going to use them again for that particular patient or problem. In this video, we're going to go over cervical fascia and cervicothoracic junction fascia with instrument-assisted soft tissue mobilization. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Now, the easiest position to do this technique with is actually sitting with them facing away from you. Make sure if you're doing this technique on a female that they are aware that you need to have access to all of this skin. So they might want to wear a sports bra, something where they can move the straps around pretty easy, or you're going to need to find some like shirts in your clinic that you can cut the neck out of. Obviously this stuff doesn't work over clothes. So I'm going to go ahead and have Yvette move this strap over her shoulder. Perfect. That's all we need. We're going to do all this area here. So this is her cervicothoracic junction, and then we're doing all of this cervical fascia. Now, we're going to add just a little bit of this cream because we don't want to just exfoliate the skin or irritate the heck out of the skin. We actually want to be able to apply some force to the fascia underneath the skin, which means I need to protect the skin with a little lubricant. Once I get this rubbed in, the other thing you might want to have handy is hair ties, right? Because we got to get the hair out of the way. Otherwise, they will get this lotion or whatever cream or oil you happen to use. We use Smart Tools cream here. I happen to like the Smart Tools set a lot, and I like the Smart Tools cream, so that's what we use. But you could use other stuff. Most of the stuff is pretty simple lotion or vitamin E oil, so it's not going to do any harm to somebody's hair. Now, first step is always to go through our scanning strokes. Now, as I've mentioned in the past, we think of these IASTM techniques as superficial fascial techniques, which means I'm going to treat this whole area like one piece. This to me is just cervical fascia. I'm not really thinking about trap or levator scapulae or scalenes at this point, just investing cervical fascia. So I'm going to start here. I'm going to have her stretch out this fascia just a little bit for me by tilting her head away, maybe a little bit of flexion, and then I'm going to go ahead and stroke down this way. And what I noticed is everything was pretty smooth until I got to this point right here. And then we'll go here, and again, right in here. And then I'm going to come through here. And again, I feel just a little bumpiness as I kind of went over the superior angle of the scapula there. I kind of felt a little bumpiness in the fascial tissue too. And then some of you guys probably already have seen the thoracic fascia, infraspinatus fascia, and deltoid video. So I could come straight across here the same way I did in that video. You can kind of see how those two videos blend together really well. A lot of people will need this kind of whole area done if they have that combination of cervical and upper body dysfunction. Now, once I've done my scan, you guys might be able to see from some previous takes, I did find some bumpiness in here, some bumpiness in here, and some bumpiness in here. From those previous takes, we have a little bit of redness already. The first thing I'm probably going to go after is think about disrupting those areas a little bit. So I think of those fascial sheaths and the fact that if we have any sort of tissue injury, right, and that could be very subacute, very subclinical tissue injury that just caused enough of an inflammatory process that we got some binding of those collagen, or binding of those fascial layers via some additional collagen being laid down. We want to break that up, and the way we're going to do that is I'm actually going to switch from this fairly sharp scanning tool to tools here. I'm going to use the shark fin tool, and I'm going to use this little batarang tool. Comes pretty handy. I'm going to start down here. We'll go low to high this time, right? And I'm just going to try to do strokes in a bunch of different directions. Now, since this is the neck, and the neck gets flared up pretty quick, I see petechiae pretty quick, I'm probably only going to do 2 to 4 strokes in each direction, because I want to make sure I can go in a lot of directions, right? So you guys just saw me go this direction, this direction, this direction. Maybe I go up a little bit. I come and do this thing where I'm pinning one side and just kind of going around a little bit. Go sideways, come down this way, and then this way a little bit. All right. And again, 15 to 20 strokes is probably good for one area. She's already pretty red in that area. If I see petechia, I know I've done enough, because after petechia it becomes bruising. I don't think petechia have anything to do with the therapeutic effect personally. I haven't seen any evidence to make me think that petechia are healthy. But again, petechia themselves is a good little indicator that, you know, if we do this much further, we could create a little painful stimulus ourselves just by creating some bruising. Now, the next thing I felt was in here. Maybe since we're so close to the neck and I have less space, I'll go to this smaller tool. Again, let's get as many directions as I can. This way, this way, this way. All right. Break that all down. And then, of course, I could do the same thing on the neck. Of course, if we get into here in these smaller areas, it definitely gets a little harder to get in there, right? So I'm using this end of the tool. Just taking it easy. You know, I have the tool set at like 30 degrees here. I'm really only pushing hard enough that I'm just feeling the layers of tissue underneath the skin, right? So there's no need to like and create a bunch of redness. Like, that's not the goal. All right, now that I've gone through and I've broken up the binding of those collagen fibers between layers of fascia that I felt didn't feel the way the other fascia felt, maybe the next thing I could go after is trigger points. Now, trigger points, I found it helpful to just literally almost do like a cross friction shearing force in all directions. So we'll go like this, all the way around. Now, this could be desensitization. This could be breaking up more of that disorderly collagen matrix that's being laid down from a dysfunctional motor end plate and acetylcholine and other cytokines and inflammatory chemicals kind of launching that inflammatory process. But what I've found from an outcomes perspective is that when I do this, I get a little bit better carryover. So I get less sensitivity from session to session in those trigger points. Trigger points have a tendency to come back less, right? Or at least with less strength. We know we always take a little step back between sessions, but I find that that step back is a little less when I do it this way. The last thing we want to do, and this is obviously the most intense technique, is the pin and stretch with these tools. The reason I do them despite their intensity is because think of how wonderfully functional that is, right? So if we want to get mobility back, the idea of pinning some of this dysfunctional tissue and then making sure that we pull other layers of fascial and muscle through that tissue is probably exactly what we're trying to get at with some of these fascially intended techniques. So here, I'm kind of going over the fascia that is connected to my levator scapulae. A good way to stretch out my levator scapulae and that fascia would then be to stretch the levator scapulae. I can just pin this way, and then if I remember my anatomy, I would go into flexion, lateral flexion, and contralateral rotation to stretch. Cool, and you can feel it under the tool as that tissue gets pulled underneath the tool. So just passive with the tool pinned statically would be the first step. The next thing I could do is ask a vet to do that actively. Okay, so now chin down, good, and look over this way. And then I could add a little overpressure. Right, so now we got active, but this stays static with overpressure. And then the most intense technique would be as she's going active and I add overpressure, I'm also pulling the tool through the tissue. right? And that gets real intense, and you can see she reddened up a lot. Be careful with these techniques. 2 to 5 strokes in any one spot with those pin and stretch is plenty. Don't think that you have to do 10, 15, 20 repetitions like we normally would with an exercise. A little bit of this goes a long way. Just what I did here, the 15 to 20 strokes over each spot in different directions, the trigger point stuff, and the 2 to 5 pin and stretch strokes, that's a lot of therapy. I'm not suggesting that you necessarily do all of this techniques on the first session with a patient. So you might start with your scanning strokes and then just trying to break up any adhesive or abnormal feeling area, and then just see how the patient comes back to you the next time. Did that help? If they felt really good, good. Now maybe go ahead and add the trigger point stuff in. And then maybe the third session you could add the pin and stretch. Or maybe the second session you did the breakup and the pin and stretch, and in the third session you add the trigger point stuff. Just kind of keep track in your notes on how they're responding to each one of these techniques, and of course be reassessing to make sure that we are having the intended outcome and this is having an effect on your objective measures, for example, something like cervical lateral flexion goniometry. All right, so there you guys have it. Stay tuned for the close-up recap. I'll show you the petechia that we created on this side, and I'll go ahead and treat this side of the neck in that close-up. All right, guys, so for the close-up recap, I'm going to grab a little of our Smart Tools cream here, throw a little lotion and get the skin nice and lubricated so we can get to those deeper layers without abrading the skin. All right, maybe I used a little bit too much lotion. I tend to use a little too much lotion, maybe more often than not. I guess it's better too much than too little. You guys will see if you use too little lotion, it like feels like a rug burn real fast. All right, so we'll get that all in there. All right, good stuff. All right, now we're going to start with our scanning strokes, but before I do that, I want to lengthen out this cervical fascia. Then I'm going to go ahead and just gently take the tool, 30-degree angle, push it into where I feel muscle kick back, and then just do nice little organized strokes so that as I'm going through each little strip of skin, I can take note on where I felt dysfunction, and I feel a little bit up in here, and a little bit right here. You know, if you felt nothing at all going through all of this, you could probably try to go a little deeper. But generally speaking, you don't have to go that deep. You don't have to go that hard with these tools. I felt a little bit in here, right? So we got a little bit here, a little bit here, a little bit here. And then we can come through this thoracic fascia this way. We could even bring in some of that infraspinatus fascia if you saw those videos. Now, once I've found the spots that I want to go back to do a little bit of treatment on, right? Think of those binding of those tissue. Maybe I'll start up here at the top of the neck. And I'm just gonna, in this way, I'm gonna almost treat this one like I treated the trigger point in the previous one, because I have such a small surface area to go after. It's gonna be hard for me to get various directions. Maybe I can get a little bit this way, but I'm probably just as well grabbing the tip of this shark fin tool and trying to break things up that way. Remember, I'm going to go in multiple directions because fascia, the collagen fibers, don't necessarily match the muscles underneath them. All right, you guys can see I got a little bit of petechia right there. All right, so then I went, this area was next. All right, so I can go in this direction, right, towards her neck. And then maybe I go at a diagonal towards the front of her neck, diagonal towards the back of her neck. I can go maybe across this way and back. Just breaking up as much as I possibly can in as many directions as I can. I don't know if you can see, if you lean back just a little bit. There you go. You guys can see I developed a little bit of petechiae. Once again, I don't think there's anything therapeutic about the petechiae, but I do think it's a good indication that maybe we should stop. And you can see I only did about 15 strokes there. We get past petechiae, we start getting bruising. All right, so the next spot we're going to do, let me have you lean forward just a little bit of that. There you go. Is this spot here, which we felt a little disruption. And now I'm just using this concave side, and I'm just doing my little sweeping strokes, I guess you'd call them. You know, I do think way too much attention is paid to the name of strokes and the fanciness of strokes. You're really just trying to get a 20 to 45 degree angle and pull tissue across other tissue. You're trying to create shearing forces. So as long as you're going in multiple directions, I think we're going to be as congruent with what the research is indicating as we can at this point. Now the next thing I might want to do is go after trigger points, and now it's funny because the common trigger point sites we already went after. That's where we felt the most abrasive or the most abnormal tissue anyway. So I'm not going to go back over this, but you guys can imagine I just use the end of this shark fin tool and go around in a circle like so. Right, really trying to break up that tissue as much as I can. Sometimes I get a petechiae, sometimes I don't, but it definitely helps with that carryover. And then last, the spin and stretch techniques. We could use this tool, right, and go just like so, get that 30 degree angle and then pull through. But we also kind of use some of the other tools, like we used this tool, fit the trap mound, we'll call it, fit the trap mound real good. So maybe I come down over like this, and then we kind of had some different levels of intensity. We had pin and passive pull through, we had pin and active pull through with overpressure, and then we had pin opposing pull through with the tool and active pull through with overpressure, right? So let's do that one more time, just like so, and then I go this way. And you only need 2 to 5 strokes like that. It's a very intense technique. Guys, I hope you enjoyed this video. If you have any questions, please leave them in the comments box below. So there you have it, instrument-assisted soft tissue mobilization. Make sure to assess, address, using the intervention, and then of course reassess. And if you get the chance, these videos are not a replacement for live education. Of course, if you get the chance, you should take live workshops or find a mentor who's experienced using these tools, or maybe a friend that wants to learn them too, so at least you can practice on each other and give each other some tactile feedback of what you feel, how you felt the next day, what results you felt that you got. I hope you guys enjoyed this video. Please feel free to leave your questions below.